recently I received for a second opinion, since I work in a third level hospital, a patient with valvular disease, especially organic mitral regurgitation. And he was very young, around the 30-year-old, and the questions were multiple for which we had to help. One was if the severity of mitral regurgitation was indeed enough to refer for surgery. The second is that he had many symptoms that did not match with his problem, and therefore was doubtful if were related to the mitral regurg. And the third is that indeed he was very young, so he wanted a resolution of his symptoms, a resolution of his problem with long-term results. So for the first, we of course apply first level imaging, like such as echocardiography. But in that case, to really quantify the mitral regurg, we also applied different methodology, including 3D echocardiography, for example. And during the first examination, we noticed that the left ventricular function was extremely diminished and the ventricle was extremely enlarged, a bit disproportionate to the severity of mitral regurg. So we wanted to go deeper in the diagnosis, and we performed also an MRI to really look better at the left ventricular function and the characteristic of the myocardium in terms of fibrosis or scar. Also in the baseline evaluation, we performed an ECG and a Holter, and indeed he had 30% of the time extrasystole. So indeed the arrhythmic profile was also very alterated and could explain some of his symptoms and also part of his left ventricular dysfunction. So we had to puzzle, we had to think a lot, and we decided that was probably necessary also to address his genetic background to see if it was behind maybe a cardiomyopathy together with the valvular heart disease. So we referred to the clinical geneticist, and indeed we found alteration in known genetic cardiomyopathy genes. So in this case, it was a complex patient, very young, with two problems together. And we had to indeed solve the mitral regurg, but together also the arrhythmic problem and the dysfunction of the ventricle. So the solution was to go in a heart team and put together not only valvular specialist, imaging specialist, but also electrophysiologist, the surgeon that had to decide when and how to operate him. And it was a long discussion that followed obviously with the patient and with the family, which we find always an important moment to explain clear to the family and to the patient what are the options and where we actually doubt. And it was decided with him to first indeed perform a mitral valvuloplasty, with the idea that being a referral center, the long results would be very good, that unloading the ventricle from the mitral regurg would help anyway also the cardiomyopathy that was behind also this disease. But during the operation also performing a voltage mapping of his ventricle and trying an ablation of the extrasystole that were so frequent. So luckily the operation went very fine. It was very recently, so I cannot tell the long results, but immediately after he was immediately improved in terms of at least his reduction in his tolerance of exercise, his shortness of breath. The extrasystole were already diminished, not completely gone, so we have to follow up that. And also his function, because it's expected in a relatively short term to see also an improvement in function. So he will be followed up, and it's very important to be with him every time, not only with the simple echo, but with an ECG and with an Holter to monitor his arrhythmic profile. And obviously in all this, we follow this with the lab, his pro-BNP that was initially elevated and was already better a few months after the operation. And he was followed clinically by me personally in order to always assess his improvement, let's say. But it was a very complex case, and it shows how you should use all the tools you have to have the best solution for the patient.